Hello everybody, I hope you had a nice day. So for today, we have a special treat. We are joined by this cutie right over here. Say hello, Padme. She's probably gonna knock out while I speak, and she's going to probably not move until I wake up in the morning. So come along and relax, just like my little baby girl right over there. I am going to do another ASMR and learn today because I am a medical student and I'm studying all the time, but honestly, I feel like hearing this type of stuff kind of helps fall asleep because you're using your brain, which makes you more tired. I do gotta say, some of this is going to be a little bit intense in a way because if you have no health background, you might not understand some of these words, but it's okay because we're just here to relax. And if you learn something, awesome. So let's do this. I'm going to focus on immunology. Specifically, I'm going to read some stuff about fevers. Okay, so what is a fever? A fever is defined as an elevation of normal body temperature. We all know this, right? And this can vary based on a number of factors. It can be the time of the day, geographical location, degree of exertion, all types of things, right? In general, a fever is defined as a temperature of more than 38 degrees Celsius, which is also 100.4 degrees Fahrenheit. Fever is a non-specific symptom. It means that there's a lot of conditions that have fever, and it can be caused by infectious or non-infectious conditions, malignancies, which is known as cancer, systemic rheumatic diseases, drug reactions, all types of things. So history and physical exams by itself are not enough to diagnose uncomplicated infectious causes such as an upper respiratory infection, gastroenteritis, things like that. Laboratory tests and imaging should be guided by the pretest probability of the differential diagnosis. So you should have a general idea of what could be causing the fever before you're going and ordering tests and imaging. Antipyretics, which is drugs to help bring down the fever, and tepid sponding, I gotta say, I don't exactly know what that is, but we're all learning here. Maybe used to decrease body temperature. But treatment of the underlying cause is the main goal when managing febrile patients. Febrile just means you have a fever. Okay, so let's go through the pathophysiology of a fever, which basically means like the mechanism behind it. So inflammation and or the infection will cause a release of endogenous pyrogens, also known as cytokines. So endogenous means it's coming from within, and those are induced by exogenous. So exogenous means from the outside, such as proteins and lipopolysaccharides. Then cytokine induced upward displacement of the set point of the hypothalamic thermoregulatory center. It's a big word, but your hypothalamus is in your brain, and there's a part in it that basically, as it says, thermoregulatory. It regulates your temperature. So then that's going to cause an elevation in the body's temperature, and there's an increase in the immune system activity, which will decrease the pathogen growth. So the pathogen is whatever is causing the disease in humans, also known as like the infection, right? So your body is fighting it off. And so this is the mechanism behind what it's doing. That's why when you're sick, you get a fever. It's a sign that your body is doing what it's supposed to and fighting something. Now, something that's interesting with fevers are there's different kinds out there. And these different patterns can help determine what the likely cause is. So we have continuous fever, right? Just basically stays the same. Remittent fever, a little bit of fluctuation. Intermittent fever, which means goes ups and downs, right? Recurrent fever means it happens several days. It can come back, goes away, comes back. And then within that, there's relapsing Epstein fever. I didn't even know what that was until this very second. But it says fever lasting 1 to 2 weeks, followed by an afebrile period of 1 to 2 weeks. Okay, so like a certain type of recurrent fever makes sense. Periodical fever, and there's still even more kinds, right? There's a biphasic fever, which means the fever will break and then return again. Undulant fever, which means it just keeps going up. Post-operative fever is usually, there's a lot of different causes, but post-operative, like after surgery, stuff like that. And what's even cooler is you can see it graphed out the different waves for the temperature over 24 hours or over days, weeks, years even, depending on the cause of the fever. Now for the diagnostic studies, again, you want to be focused. You want to have a general idea of what you're looking for before you test for them. So main ones, you're going to have like a CBC, blood glucose. If it can affect the liver, you want to look for the liver enzymes, things like that. If you suspect something like sepsis, you can go into more in-depth, like a chest x-ray, blood cultures, blood gas analysis, all types of things. And then there's even more specific testings that can happen depending on what you're looking for. Like for instance, if you think someone might have strep throat, you can do a strep test, right? If you think they have a type of pneumonia, look into the lungs, pulmonary exams. So you got like chest x-rays and CTs, all these types of stuff. Cardiovascular, you look for EKG, troponins, abdominal, you look into x-ray of the abdomen, you can do stool cultures, urologic or pelvic, urine cultures, you can do ultrasounds, neurologic, psychiatric, excuse my terms, don't have the greatest pronunciation always, toxicology screens, lumbar punctures, MRI. Each system in the body, there's different things you can be doing. It's amazing when you see the long line of the differential diagnosis for each different system in the body. There's so many. This is why it's so important to have an idea of what can be causing it before you just start doing these tests. You don't want to be putting a patient through a bunch of tests they don't need, but you also don't want to be missing things that are pretty pertinent, which means important. And this is where risk factors come into play, right? Did someone travel recently? Do they have any autoimmune conditions? Are they under a lot of stress? Do they have any certain infections that could have happened recently? All these type of things come into play. I hope you enjoyed learning about fevers with me. I can tell you that this little cutie did in fact knock out, and I hope it was relaxing for you as well. And let me know if you learned anything. Talk to you later.